Usually, your dog is always on the run, but this time, maybe they have the runs. Here's why your dog is having diarrhea. Welcome back to Alpha Paw, your destination for everything dog. I'm Bernie Zilio, and I'm on a mission to answer every doggone question you have ever had about your fur babies. And today, we are talking about why your dog may be having diarrhea and what to do about it. Fortunately, we have an expert with us today, Dr. Ross Bernstein. Dr. Ross is a seasoned veterinary professional and pet care expert. He earned his doctorate degree in veterinary medicine at UC Davis School of Veterinary Medicine, and his work has been featured in several industry-leading publications, including the Journal of Veterinary Surgery. He is our go-to vet for everything we want and need to know about our fur babies. So welcome back to Alpha Paw, Dr. Ross.
Hey, Bernie. How you doing?
I am doing wonderful, Dr. Ross. How are you?
I'm great as well.
Okay, great. Now, yet another poop talk with you, Dr. Ross. I feel like that is all we talk about, but anyone who owns a dog knows that is all anyone who owns a dog talks about.
Great day to talk about poop.
It's always a great day to talk about poop. Now, diarrhea is something that pet parents, unfortunately, are all too familiar with because it seems like anytime we see our dog with runny stool, we start panicking and doing some mental inventory. What did they eat? Where were we? Have they been stressed? I mean, there's so many factors that can cause runny stool in our dogs. But I want to know just medically in general, what causes diarrhea?
First, we'll talk about what diarrhea is. It's basically when the intestines do not have a chance to fully absorb all the nutrients. Usually when the poop is passing through the large intestine, there are special absorbers in there that reabsorb the water. And so that can be one of the reasons why there's diarrhea. It can just pass through very quickly, and you can have electrolyte abnormalities or intestinal malabsorption. Lots of different things can be causing diarrhea, but it's much softer stool than normal. Sometimes there can be mucus in there, sometimes blood, but the water content in the fecal sample is generally a lot higher when it's considered diarrhea. There are different kinds of diarrhea, which maybe is like, whoa, there's different kinds, but there is large bowel diarrhea, small bowel diarrhea. And so depending on kind of like the history that we figure out, if your dog is having lots of little episodes of diarrhea, or if there is fresh and frank blood in the poop, then we can consider that large bowel diarrhea. And that can be due to a issue with the large intestine. Rather than if it's what's called melena, or if it's a black and tarry stool, that means there's digested blood in it. So the problem is higher up in the intestinal tract. So in your small intestine, that gives your intestines a chance to digest the blood before it comes out. So the problem is originating higher up. When there's a small bowel diarrhea, those are often more infrequent episodes, and they're often much larger sample size, not the right way, larger stool samples.
Interesting. I know this sounds crazy because a lot of us know what it looks like, but I didn't know what exactly caused it, like inside the body. So thank you for explaining that. Now, like you were saying, in our dogs, there can be 1,000,001 things that can cause diarrhea, but what are some of the most common things that can contribute to it?
In a puppy or dogs less than a year old, gastrointestinal parasites or worms are going to be one of the biggest causes. So those include Giardia, coccidia, roundworms, whipworms, hookworms, all different types of worms.
All the worms.
Some of these can be transmitted to people. So that's why it's very important to get them dewormed. And of course, a lot of them can be transmitted to other dogs or other animals. Another thing that's very common in puppies and young dogs is what's called dietary indiscretion. It's a very fancy word by saying dogs eat all sorts of things, including their own poop or other dogs' poop, stuff out the trash, their toys. You name it. When they eat stuff that's not a food item, or it could be even just something that they don't normally eat, it can be irritating to their gastrointestinal tract, inflammatory. It just doesn't go through well. Sometimes it can cause erosions as it passes through, which can be irritating to the gut and cause diarrhea. So in young dogs, I would say those are the two most common causes.
So basically, anything and everything can potentially cause diarrhea in the dogs, is what you're saying. But should we ever really be like super concerned? Because I know diarrhea can be a symptom of something way more serious. Should we ever really be super concerned about it?
Yeah, I mean, anytime there's diarrhea, it's not normal. So if there's diarrhea, then that means that there is an underlying problem. A lot of diarrheas are fixable. So if it's due to worms in the gastrointestinal tract, those are often fixable. If it's due to dietary indiscretion and they get what's called a dysbiosis, when the relative populations of bacteria lining the gut. So our intestinal tract is filled with bacteria. A lot of them are normally good bacteria that help us digest our food. When they start having diarrhea because they ate something unusual, that population of good bacteria and bad bacteria can get out of proportion. And so you want to restore that main balance. So that's why sometimes things like probiotics can be helpful, because that restores the good population of bacteria there. When the diarrhea is not getting better after trying some medications or diet therapy, that's when you start getting concerned about a more severe underlying condition, such as a malabsorptive issue, inflammatory bowel disease, or in some bad cases, some stuff like cancer.
Obviously, what you're saying is it can range. It could just be they ate something weird versus something's really, really wrong. So at what point in this process should we be concerned enough that we consult our veterinarian?
Yeah, I think that goes to the level of comfort of the owner. If you're ever not sure or you're ever concerned, it's never wrong to reach out to your veterinarian. We are here to help you. Your veterinarian is there to help you, give you advice, let you know what is normal, what is not normal. And so your veterinarian job is there to answer your questions and make sure your dog is as happy and healthy as they can be. Now, if there's blood in the stool, if it's black or tarry, if the diarrhea is coming along with other signs such as decreased appetite, lethargy, vomiting, that's when it can start to be more serious. If it's also lasting for several days, that's another sign that potentially it's a bit more serious.
Okay, really good to know. Now, our dogs have had diarrhea for a few days. We take the dog to the vet. Now, how do you guys determine what the cause is of the diarrhea?
Yeah, there's lots of things that we can do. So it's going to start with what's called getting a good history. So we're going to ask you questions like, how long has this been going on? Have you noticed blood in it? Did they eat anything unusual around the house? All this can give us hints and clues as to what might be the underlying cause. But let's say sometimes the owners doesn't know. Everything's been normal. Everything's nothing that they can think of. So we're going to start with ruling some stuff out. So we're going to start with some fecal testing, making sure that there's no intestinal parasites. Sometimes we just deworm them anyway, just to rule that out and make sure that it's not a gastrointestinal parasite. Sometimes we can try things like a diet modification or diet therapy. So that often consists of a low-fat, highly digestible diet. Fat can be very inflammatory to the GI tract. So low-fat diets in an acute diarrhea can be very helpful. And then we're going to try some other medications. So usually stuff like metronidazole is a good first line medication that can help restore that balance. If it's still not getting better, some other tests that we can do is blood work. We can look at the level of proteins in the blood, look at the kidney function, liver function, red blood cells, white blood cells, platelets, full systemic evaluation. If that still doesn't give us clues, we can also do what's called an abdominal ultrasound, which is a scan of the abdomen, and we get 3D live images, and we can see pictures and see what the abdomen looks like. So you can actually see if the GI tract is inflamed. You can see if there is enteritis or pancreatitis. You can look in there and see if they did eat something unusual. So those are some diagnostics that you can do that your vets can do to help you figure it out.
Awesome. Thank you so much. My dog Pod loves diarrhea. So he has joined us today. It's hard to see his face, but he brought his favorite ball and he is taking notes on everything we're saying. I was going to ask you about treatments, but you kind of spoke about all the different kinds of treatments in the previous answer because you're just that good and you can read my brain and you're like, I know exactly what she's going to ask next. But is there anything else you wanted to add about diarrhea before we wrap up, Dr. Ross?
Yeah, sometimes for figuring out what the cause is of diarrhea, sometimes your vet or you're never going to figure out an exact cause. And so you can do what's called symptomatic or supportive care. And so that diet therapy, some of those medications that we talked about, probiotics, sometimes that is a way to figure out what's going on. And if they respond to that initial empirical therapy, or empirical meaning you don't actually know what's going on, you're just treating for what you think it might be. If they respond to that, great. But then if they don't, then your vet might start recommending further tests such as fecal testing, blood tests, abdominal ultrasound, and you can dig a little deeper to try to find the underlying cause.
Awesome. Well, as always, this has been incredibly fascinating and helpful and informative and all of those good things. So thank you so much, Dr. Ross. And if you guys, our viewers, have any questions, comments, or concerns, please drop them down in the comment section below. Again, I'm Bernie Zilio, and this is Alpha Paw. Be sure to subscribe so you don't miss one single doggone episode. We'll see you next time.